Hello, my name is Erica Starling, and this is the X-Treme Makeover PowerPoint for NU713, Organizational and Systems Leadership for the Advanced Practice Nurse. The purpose of this PowerPoint presentation is to identify miscommunication while working and recognize how it occurred. The story will then be changed to include positive communication. Pull till full is inarguably considered by most emergency department operations experts to be best practice. Pull until full is not a new concept, but it was a new concept for this author's place of employment and is utilized during the triage process. The patient checks in with the triage nurse, who does a brief assessment and then immediately places the patient into an open ED bed. Each patient is immediately brought back to each open room until the rooms are full. When the rooms are full, the triage nurse begins triaging each patient as always. The ED beds are broken into pods while utilizing pull till full, and at this particular facility, each physician is responsible for one pod, which totals 8 patient beds. Physician assistants are assigned to the fast track area and maintain the 8 fast track patient beds. The breakdown occurred recently as the bed opening times are staggered. Fast track in one individual pod is always open. The next pod opens at 9 a.m. and the final pod opens at 10 a.m. and they close each night. It was 9:45 and the physician for pod 2, the 9 a.m. pod, received his 6th patient in an hour and was upset. This is a common occurrence because when the beds are available, they are filled quickly. The physician went to the charge nurse and expressed his anger on receiving another patient right before the next pod opened. He began yelling and would not listen to rationales, as he thought the patient could either wait for the 10 o'clock pod to open or be placed in the pod 15 minutes early. The physician demanded that the triage nurse be reprimanded, and he angrily left the charge nurse's desk. The miscommunication occurred between the physician, the triage nurse, and the charge nurse. The physician could have calmly approached the charge nurse to look for the rationale to place another patient in his zone. The charge nurse could have asked the triage nurse what her reasoning was to place this patient in this area. On this particular day, there was no staff to manage the 10 a.m. pod early, as the next group of nurses came on shift at 10 a.m. This would have caused the patient to sit in a treatment room for 15 minutes without a full triage or nurse assessment. If the physician had approached calmly, the charge nurse could have explained this to him. The variables that contributed to this miscommunication was neglect of listening on the physician's part, the stress of receiving multiple patients within the span of 1 hour, and lack of communication with the triage nurse and charge nurse. During lunch, there were many different conversation themes. One of the recent conversations is the overwhelming number of admit holds that nursing staff has. Unfortunately, there are not enough patient beds to satisfy the need in this area, and the hospital has to go on diversion often. This creates patient admit holds in the emergency department. Nursing staff have to carry out admit orders along with care for their ED patients, causing frustration. Staff shortage is a cause for both having admit holds and causing ED nurse frustration. There is a high turnover rate at this hospital in the ED, causing nurse strain and burnout. The high turnover rate is mainly due to many of the nurses being in military families or nurses who received their experience to pursue traveling. Nurses also feel that they are not appreciated, as they work overtime often, take extra patients, and work hard, but management sometimes do not show their appreciation. This also creates high turnover rates and increases frustration. The culture portrayed is burnout, frustration, unappreciated, high turnover, and strain. Unfortunately, since there is such a high turnover rate, there are many new nurses who sense the burnout and quickly become burnout as well. Organization as conversation is broken into 2 patterns: patterns of meaning and patterns of relating. Patterns of meaning relates to the themes that exist in organizations, while patterns of relating is how employees interact together to form the culture of the organization. The culture and theme of this author's hospital is frustration and strain. Communication is a large problem with this organization, as the nurses feel like management and administration do not care and do not listen. There are many issues prompting nurses to leave, but instead of asking nurses why they want to leave, management is just angry with them. If relational leading was utilized, it would place emphasis collaboration dialogue, horizontal decisions, and continual learning. This author's organization reports that their mission, vision, and values are to provide quality healthcare and wellness to the area, be recognized as the healthcare provider of choice, and to serve by providing service, excellence, respect, value, and enthusiasm. The nurses are unable to fully uphold all the values in this organization holds as the standard because they have little staff or burnout and are frustrated. Elements of power are included on all human interactions and processes of relating. Power enables relating as entering into relationships. One is constrained and both enables and is enabled by others. By entering these relationships, it forms a pattern which evokes the feeling of belonging. Each nurse must feel like they belong in order to form a relationship and feel as though they belong. Unfortunately, nurses do not feel important, valued, or appreciated in this organization, as administration does not listen to their concerns or take their opinions into consideration when decisions are made affecting nurses directly. Ways of talking are patterns that develop that reinforce and stabilize the cultures and themes of the organization. Each conversation, no matter how small, go towards the culture at the organization. By choosing appropriate wording and being aware of the conversations occurring, it could help to decrease frustration and negativity. Listening is often overlooked, but important to integrate into organizations. Many staff feel that their opinions aren't heard or listened to. Utilizing active listening and appropriate nonverbal cues is an important piece of collaborative communication. Being mindful is being aware and awake in the present moment. If the managers and leaders utilize the ways of talking, listening, and mindfulness, they would be more aware of the issues the nurses have and hopefully prevent the negativity from influencing behavior in the long run. Innovation is the emergence of structures of meaning, and it takes misunderstanding for innovation to occur. Innovation represents the ideas or process that can emerge from ongoing conversations. With innovation, all parties must be able to listen to ideas to discuss them. This organization suppresses innovators because the administration team and department managers have a "we know best" approach. By ignoring ideas, the staff do not feel that their innovation is welcome and become increasingly frustrated and eventually give up. By changing the story, the organization would focus more on ideas brought on by staff who perform the work daily. The organization will work harder to work towards the standards of the values upheld. There would be listening and discussion of ways to improve. Patterns of meaning, and since patterns of meaning focus on the mission, values, and meaning, it would be stressed that this organization should be the leader in healthcare for the area. By becoming the healthcare leader, the staff should feel appreciated and important. The staff will be encouraged to express their feelings and concerns to help further change the organization. By utilizing effective communication by talking, purposeful listening, and mindfulness, employees would feel appreciated and heard with their ideas and concerns. By using effective communication, listening, and mindfulness, it would promote the building and maintenance of healthy, trusting relationships between both the leaders and the staff. By utilizing innovation, it would promote growth in the organization. Each person has a different idea or outlook on a situation, and by promoting innovation, it would let each employee have an opinion which incorporates diversity. There would be conversations of hard topics that could help encourage innovators to promote change. Changing the story. While continuing to utilize Pull Till Full at 9:45, when it is known that the next pot opens in 15 minutes, there would be communication with both the physician and the charge nurse. The charge nurse would evaluate staffing, and if there were enough nurses, open the next zone as to decrease stress on the previous physician. If there was not enough staff to open the beds early, then it would be communicated to the physician, and if she was overwhelmed, then the charge nurse could speak to the triage nurse and have only severely ill, injured patients brought back until the next zone opened as to decrease frustration. Thank you.